My name is Declan Murphy. I'm a consultant urologist at the Peter MacCallum Cancer Centre, and my main area of expertise is prostate cancer. So the prostate is a small gland that only men have. It sits low down in the pelvis, just underneath the bladder, and it plays an important role in the earlier part of life because it facilitates reproduction. So it's an important organ for contributing to ejaculation, for example. But in later life, it tends to be a bit of a nuisance because it enlarges and causes urinary symptoms, and it also can become cancerous, leading to potentially adverse effects for men as we get older. So prostate cancer is the most common cancer in Australian men. It affects over 20,000 men here in Australia every year and leads to death in about 3,000 or 4,000 men every year in Australia. So it is a major issue for Australian men. So like all cancers, prostate cancer is a malignancy that develops in otherwise normal tissue. So the prostate starts off life as quite a normal organ, but as it gets older, it transforms and can become a cancerous or malignant organ. So it usually starts out as a small tumour within the gland, and if it's left undetected, it can spread to other areas and cause lots of problems as it develops. Prostate cancer rarely has any symptoms or signs in its early stages, so therefore we rely on testing to determine whether or not prostate cancer is present. Of course, as we get older, many men develop urinary symptoms, which is not necessarily a sign of prostate cancer. So for example, finding it a bit more difficult to get the urine flowing, going a little bit more often, getting up at night to go to the bathroom, etc., is usually a sign of the prostate becoming enlarged, which is a natural process as we get older, rather than prostate cancer per se. Yet the message remains the same. If you're experiencing urinary symptoms like that, pop along to your GP and get checked out. So all men over the age of 45 should go along to their GP and have a conversation about the pros and cons of prostate cancer testing in their own circumstance. For example, men who have had a father or a brother diagnosed with prostate cancer are more at risk of developing prostate cancer, and they are men who, in their 40s, we might encourage to have a blood test and an examination to help determine their risk. Testing for prostate cancer is very straightforward. It involves two things. First of all, a simple blood test that your GP can do, and second of all, an examination of the prostate. And this is the bit that normally puts men off, but it usually turns out to be the thing one should least be scared of. It does involve putting a finger in the back passage briefly, just to check for the size and shape of the prostate. And men tend to fret about it and worry about it beforehand, and then it's all over after a couple of seconds, and it's no big deal. So two simple things, and it is by far the best way we have in this day and age of testing for prostate cancer. So the PSA test and the finger examination do not actually confirm the diagnosis of prostate cancer, but they raise the suspicion. For the diagnosis to be confirmed, your GP will send you on to a urologist like me who will evaluate you and, if necessary, do a biopsy of the prostate. A biopsy of the prostate is usually done as a day trip to the hospital and involves taking a number of small samples out of the prostate to see whether or not there's cancer present. There are many options for the treatment of prostate cancer, provided it's confined within the prostate. And in actual fact, because we frequently diagnose men with quite early stage prostate cancer, which doesn't appear terribly aggressive, one of the first options is merely to keep it under surveillance for a number of years in the hope that it won't progress during that time. But if it does show signs of progression, we can still operate or do radiotherapy in plenty of time. We call this strategy active surveillance, which spares men the side effects of treatment, yet their cancer is not at risk of progressing and causing a bad outcome. Another option for the treatment of early prostate cancer is surgery. Traditionally, this has involved a large incision to remove the prostate, and traditionally 6 or 7 days in hospital. But nowadays we tend to remove the prostate with more advanced keyhole surgery methods, often using a robot, and patients tend to recover from this very quickly. It remains the best way we have of curing prostate cancer, yet there are still side effects of all of these treatments which your urologist would discuss with you. And another treatment option is radiation treatment to the prostate. So radiation treatment is also very effective at curing prostate cancer. It can be delivered as an outpatient by coming to visit the hospital every day for 5 or 6 weeks, or it can be delivered by implanting radioactive seeds into the prostate as a day case trip to the hospital. So all in all, there are a number of treatment options for prostate cancer, provided it's detected at an early stage. Well, the decision about which treatment is most suitable for a particular patient depends on a number of factors. First of all, the age of the patient and their general fitness for surgery, for example. Second, the type and stage of prostate cancer they have. And third, the lifestyle of that patient. And patients will often make a decision about a treatment option based on their own lifestyle, whether they want to travel in the next few weeks, etc., etc. So this time when a patient is faced with a number of choices can be quite bewildering, and we do our best to help patients through that decision-making process so they make a decision best for them at that particular time. So removing the prostate, even though we do it with minimally invasive technology nowadays, is still a big operation. There are two main side effects that men tend to worry about. First is the effect of removal of the prostate on their continence, on their ability to retain urine, and second is on their ability to have an erection and sexual function following surgery. So there's no doubt about it that removal of the prostate does have an impact on both of those. In the case of continence, it's usually short-lived difficulty in holding their urine while they recover from the surgery, particularly in the first couple of weeks afterwards. But ultimately, 6 months later, 95% of men are fully continent again, recovered from their surgery. Regarding the sexual dysfunction following the surgery, because the prostate is very close to the nerves that supply the penis, removal of the prostate does have an effect on those nerves. It can depend a little on the type of cancer they have, but nowadays 70 or 80% of men will recover reasonable erections following removal of the prostate, provided they've had good erections beforehand. Men often ask, is there anything they could be doing to prevent their risk of developing prostate cancer? The simple answer is there probably is not. We did think that taking supplements like zinc and selenium provided some protection against prostate cancer, but recent evidence has shown that those supplements in particular do not have any effect. I think the best advice we can give men is to have a healthy, balanced diet without too much fat, too much alcohol, and too much weight gain. And doing all of that minimises not just their prostate risk factors, but all their risk factors. And that's the best advice we can give at this time. The first thing is, don't do nothing. Nowadays, there's no excuse for not talking about prostate cancer with your mates or with your GP. It's very common in Australia, and it's very important to have some prostate cancer awareness and at least go and get yourself better informed. The second thing is, the advice nowadays is that men aged 45 or older should go to their GP and have a consultation about prostate cancer risk and consider having a PSA test and an examination. The third thing is, being diagnosed with prostate cancer does not necessarily mean you need treatment for prostate cancer. Increasingly, we're diagnosing men who have low-risk prostate cancer who don't require treatment, and we can keep under surveillance for many years without requiring treatment. But at least if they do need treatment, we'll catch the cancer in time and give them the best possible outcome.